Welcome to the YouTube live book reading of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. And I'm your moderator and narrator, Uriel Riley. Wow. Whew. Happy Sunday. What's up? Peace, YouTube. Wow. We are in chapter 26. We pick up at page 398. Wish you all are having divine rising. Highest heart love. Welcome to the YouTube live book reading. All right. See, I'll put it all in the playlist and then you just click on it and read through this entire book as we are reaching a pinnacle. Acute hemorrhage, page 398. This commonly occurs secondary to trauma, gastrointestinal bleeding, or surgical manipulation, and is a common clinical cause of absolute hypovolemia in adults. Most patients can sustain a 10% loss in blood volume, e.g., donating a unit of blood without significant effects. Up to 20% of the blood volume can be acutely lost with minimal effects as long as the patient remains supine and inactive. However, upon assuming an upright position, that individual will usually experience postural hypotension and tachycardia. Most patients who acutely lose 30 to 50% of their blood volume will show clinical evidence of severe low flow state and require rapid reestablishment of their blood volume. Patients acutely losing more than 50% of their blood volume frequently develop what is termed irreversible shock, in spite of rapid and aggressive blood volume replacement. The degree of acute blood loss cannot be accurately quantitated by measuring the hematocrit or hemoglobin content because 24 to 72 hours is required for equilibration of total body water, TBW, between intracellular and extracellular compartments. Dehydration. This blood volume depletion results from a loss of total body water. Initially, several mechanisms allow water to shift from the interstitial to intravascular compartment in response to dehydration, e.g., protein mobilized from lymphatics to blood. Such mechanisms are effective for only limited periods of time. Chronically ill patients and those at bed rest for prolonged periods have lower blood volumes than would be predicted. Ultimately, all water shifts must be proportional in all compartments. Maintenance of total body water is essential to maintenance of adequate blood volume. Very key. Thank you. All right, top of page 399. Third space fluid loss. This refers to fluid loss from normal functioning compartments, but still remaining within the body. The most common examples are found with abdominal surgery, where fluid is sequestered in the bowel peritoneal surfaces, or with bowel obstruction or paralytic ileus, which often results in retention of large amounts of fluid within the lumen of the gastrointestinal tract. This type of problem can be very difficult to deal with. The exact amount of fluid loss is difficult to quantitate since it remains within the body. Very key. Absolute hypervolemia. Absolute hypervolemia is defined as an increase in blood volume from the patient's normal volume. This is most commonly seen in patients with congestive heart failure, severe oliguric renal disease, and after administration of excessive intravenous fluid. Venous return, very key, very key. For those taking notes, I will stress this part enough. Cannot stress the venous return. All right. In the middle of page 399. Cardiac output equals the stroke volume times the rate. CO equals SV times rate. Ventricular preload and therefore stroke volume is greatly dependent upon the venous return of blood to the heart, since the heart cannot pump out more blood than it receives. Thus, a thorough understanding of venous flow capabilities becomes paramount in understanding venous return. The anatomy and general physiology of the vascular system have been discussed in Chapter 2. It should be recalled that 65 to 70% of the intravascular volume is contained within the venous system. The arterial system is relatively fixed in its ability to alter volume compared to the venous system, which has relatively great ability to alter volume. This is going to be very key because this is what we see with capillary blood flow. That's why the venous return is so powerful, all right? Venous driving pressure. For blood flow through the venous system to the atrium requires a pressure gradient, delta P. Flow in the large veins can be affected by abdominal and intrathoracic pressure changes. However, flow through the smaller or peripheral veins and venules is primarily a reflection of local organ system demands and the pressure gradient developed by smooth muscle activity varying the vessel caliber. See, this is very key. Peace, highest heart, love. Happy Sunday. All right. Peace, you two. We're reading books and learning from masters. This is clinical application of respiratory care. Came at the perfect time. I put these all in a playlist with the vocabulary, and you'll just be able to click on, just like all the other books, the book and just read the entire book with us. So, highest heart love. Thank you so much. Live from the light here in LA. And as we reach we're in chapter 26, and we have just reached page 400. All here live from the light here in LA. Thank you so much. Happy football day to all of you. All right. So this is figure 26.5, a model of venous capacitance. All right. So you have the minimum capacitance, the maximum capacitance, and normal capacitance. It says a model of venous capacitance. See text. I'm going to read through. The pressure is going up, and you'll see the line graph taking you from down at the bottom and going up through the top with maximum capacitance. All right. Welcome. Thank you so much for reading books with us. Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Second edition, 1979. All right. So, Venus capacitance. Thank you so much for the likes and subs. We're pushing towards 600 on this channel, reading books. We started from the beginning, reading anthropology, and now we're in medical books. So thank you so much. I know it's a very high level vocabulary, super high level. It's supposed to be like that. Masters are always going to be master. Figure 26.5 represents a model in which the venous capacitance may be conceived as an ability to store blood. Whenever the venous system contains a blood volume below its upper limit of storage capability, maximum capacitance, variations in volume result in relatively small pressure changes. That's why density matters. And, yeah, it's just very important. Variations in volume result in relatively small pressure changes. When the venous system contains a blood volume above its maximum storage capacity, addition of further volume results in relatively large increases in pressure. Although this model is not identical to lung compliance, similarities between lung compliance and venous capacitance are found in terms of pressure volume interrelationships. Ding! Drop a pin there, right? So, see, as the volume gets bigger, the pressures are greater in certain areas, right? Very, very key. Yeah, the interrelationships. In general, at any moment in time, the venous capacitance is determined in part by venous tone. Volumes below this storage capacity may be varied, with resultant small pressure changes. Volume variation above storage capacity results in large pressure changes. See figure 26.5, what we just looked at. Venotone. This may be defined as the state of contraction of smooth muscle within the venous walls. This is primarily under the control of the sympathetic nervous system, which is the fight or flight part, right? This all goes back to the breath, the diaphragmatic breath, right? Controlling and regulating the sympathetic with the parasympathetic nervous system. That's why we're reading this book. Master thyself, and thou shalt know the whole world. Yes. Venotone and venous capacitance are inversely related, i.e., as venotone increases, venous capacitance decreases. When venotone is maximum, a state of minimum capacitance may be defined. When a state of minimum capacitance exists, any reduction in venous fluid volume will result in a marked decrease in pressure. See figure 26.5. Here we go. This is 26.5. It says schematic representation of venous flow when driving pressure remains constant while conductance increases. A represents constricted veins with a driving pressure, peripheral pressure minus atrial pressure, of 5 and a flow of 50. Conductance equals 10. 50 divided by 5. Yes. And then B represents dilated veins with a driving pressure of 5 and a flow of 200. Conductance equals 40. Increasing conductance will result in increased flows in the driving pressure is kept constant. F equals flow and delta P equals pressure change. All right, here you go. The right atrium and peripheral pressure equal 10. The right atrium pressure equals 5. The flow coming in at 200 milliliters per second. And the flow in B or A is 50 milliliters per second, as you'll see. We're in the 26th chapter, Physiology of Circulation and Perfusion, of this masterful healing book. Welcome to the smart, chill, cool part, peaceful part of YouTube, where we read books and learn from masters. This is Clinical Application of Respiratory Care, second edition, 1979, Yearbook Medical Publishers. All right. I wish you were having a wonderful Sunday. This is just brilliant, right? We're starting off. Yes. We do at a high level. Wake it up. Masters Corner of YouTube. All right. Venous conductance. This is the capability to convey flow easily. Since the concept of resistance is generally well understood by the respiratory care practitioner, it is easier to approach the concept of conductance by first considering resistance. The smaller a caliber of vessel, the greater the resistance to flow. And as the resistance equals delta P over F. This relationship is as valid from the opposite viewpoint, i.e., the less the resistance, the greater the ability to convey flow. Thus, conductance may be defined as the reciprocal of resistance. Conductance equals F over delta P. The greater the conductance, the less the resistance, the greater the ability to convey flow. From yet another viewpoint, the greater the conductance, the greater the flow resulting from a given driving pressure, which is 26.6. Drop a pin there. Ding! The reciprocal of resistance equals 1 over R. Why? It would be the reverse. That's what reciprocal means. I'll put the vocabulary in the completed description. All right, here we go. We're in the 7th section of this book, page 402. Vascular volume to vascular space relationship. Venous flow may be theoretically improved by 2 mechanisms. 1, increasing driving pressure. And 2, improving conductance. Venous driving pressures may be increased by either decreasing atrial pressure or increasing venotone in the more peripheral portions of the venous system. Venous conductance may be enhanced by increasing vessel caliber. Clinical and increased venous volume is most often accompanied by decreasing venotone. It is this mechanism which usually allows intravenous fluid therapy to increase conductance and maintain venous driving pressure. Increasing driving pressure, or venoconstriction, is the most common mechanism increasing venous return that the body invokes in response to acute physiologic stress. Improving conductance Intravenous fluid administration is the most common mechanism accomplished in acute supportive care. In other words, optimizing the relationship of vascular volume to vascular space in primary means for medically optimizing venous return and thereby ventricular preload. Perfusion. Circulation and perfusion of blood are responsible for supplying all nutrients to living cells and removing their metabolic waste products. To accomplish this task, there must be adequate blood flow through the capillary beds that pervade all tissue. These capillary beds are referred to as the microcirculation. Their anatomy and general physiology have been discussed previously. See Chapter 2. Perfusion is defined as blood flow through the microcirculation of organ systems. It is imperative to appreciate that circulation and perfusion are not synonymous. Inadequate circulation is almost always accompanied by inadequate perfusion. However, adequate circulation does not necessarily assure adequate perfusion. Thus, perfusion depends not only on adequate circulation, but also on appropriate arteriolar and microcirculatory function. Distribution of circulation. The primary role of arteries is to rapidly transport blood from the heart to the microcirculation. Arterioles have the ability to significantly alter their resistance and thereby determine the distribution of blood to various organs as well as to tissue beds within those organ systems. And there's a note down here at the bottom of page 402. I'm loving this. This is so good. Oh, it's a cool room. Thank you so much. Highest heart love. Oh my goodness. Much love. Yes, this is the peaceful part of YouTube. Yeah. Gratitude. Highest heart love. The note says, note that an increased arterial pressure is directly produced when airway pressure therapy is instituted. It is often this increased intrathoracic pressure that directly causes decreased venous return. This crucial function is under the control of numerous mechanisms, e.g., autonomic nervous system, hormonal systems. The combination of these mechanisms acting on both the arterioles and the microcirculation is referred to as autoregulation. There we go. That's where it first comes up. Dealing with the autonomic nervous system. So, named autoregulation. How our body goes into modes without us having to tell it to. It's masterful. Autoregulation. I'll put it in the description. Under normal circumstances, the distribution of blood flow to organ systems correlates with oxygen requirements. In other words, organ systems generally receive portion of the total cardiac output that are proportional to that organ's metabolic demand. In a simplified fashion, then, metabolic demands may be equated with organ systems' oxygen consumption, except in three organ systems. 1, kidneys. 2, skin. And 3, heart. The kidneys normally receive about 25% of the cardiac output while utilizing only 10% of the body's total oxygen consumption. This disparity is in response to the kidney's role in filtering out 10% of the cardiac output while using only 5% of the body's total oxygen consumption. This is secondary to the role of cutaneous circulation as a temperature regulator. The heart normally receives about 5% of the cardiac output while utilizing 10% of the body's total oxygen consumption. This necessitates a large extraction of oxygen from the coronary blood supply and results in extremely desaturated coronary sinus blood. The clinical implication is that since there is normally very little available oxygen remaining in coronary sinus venous blood, oxygen supply to the heart is vitally dependent upon maintenance of adequate coronary blood flow. We are doing it. Page 403, down at the bottom. Assessment of perfusion. Welcome, YouTube. Peace. Hi, it's Heart Love. Welcome to this peaceful part of YouTube where we read books and learn from masters. We're in the 26th chapter, and you'll be able to, that you're catching it live is really cool because I put them all into a playlist and then you can just read the book from start to finish. So this is a cool part of YouTube that you found, and I welcome you for being here and being here. Assessment of perfusion. The capillary beds of various organ systems function as indigenous units. The functions of true capillaries, postcapillary sphincters, and metatarsials, see chapter 2, are mediated by numerous local vasoconstrictive mediators and metabolites that reflect local metabolic phenomena. This local autoregulation or vasomotion is in addition to regional and central regulatory mechanisms. The autoregulatory capabilities of various capillary beds vary dramatically, e.g., the autoregulatory capabilities of the pulmonary capillaries are relatively limited compared to those of the CNS. However, when confronted with significant physiologic stress, vital organ perfusion will generally be favored over musculoskeletal perfusion. The next chapter is devoted to the clinical assessment of circulation. Presently available measurements and techniques allow quantitative and objective assessment of the circulation, but unfortunately, the same is not true of clinical assessment of perfusion. We must still depend on routine clinical observations to assess perfusion status. Now we know we have machines that can do it. So beautiful to see the progression in healthcare, right? We've done it. That's why more should be able to get it. Should be for everyone, especially quality, good healthcare, right? So that's why we master thyself, so we can help others around us. A decrease in peripheral skin temperature is an early clinical indication of perfusion deficit. The skin normally receives a significant portion of the cardiac output, and this can be readily decreased with minimal detriment to the organism. Cold and clammy extremities are early signs of perfusion deficit. This is very key, everyone. Taking notes because these are observations, all right? Very part of and foundation of the clinical assessment model. The fingernail beds are readily available for clinical observation, the micro the microcirculation. After compressing and following release of the nail, the resultant blanching should readily disappear if microcirculatory blood flow is adequate. Good nail bed capillary fill is reassuring, since extremity perfusion is usually diminished early in perfusion crisis. Sensorium is a useful basis for assessment. CNS perfusion is usually favored in stress. Conscious cerebral function is very sensitive to oxygen lack, and therefore changes in sensorium, agitation, obtundation, or confusion will occur when perfusion to the brain is diminished. An alert and oriented patient has adequate perfusion of the brain. Assessment of urine output is a very useful reflection of kidney perfusion status. In physiologic, mhm, yeah, assessment of urine output is very useful reflection of kidney perfusion status. In physiologic stress, the urine output is initially somewhat diminished because of increased fluid reabsorption. However, in prolonged severe physiologic stress, renal blood flow is significantly decreased and therefore urine output approaches zero. Placement of a urinary catheter allows serial observations of urine output. A major limitation to this evaluation process is the difficulty in separating pre-existent renal disease from the acute process. Summary. Welcome. Thank you for being here on this beautiful, beautiful Sunday. Highest heart love. We'll breathe and sing I love you. The completion of this next paragraph. Here we go. Summary. Circulation has been defined as blood flow through the heart and vascular system. Perfusion as blood flow through the microcirculation of organ systems. Perfusion is dependent on an adequate circulation and on numerous autoregulatory mechanisms. Circulation is dependent on adequate myocardial function and venous return. Myocardial performance is affected by the state of contractility as well as by adequate ventricular preload and acceptable ventricular afterload. Venous return is primarily a function of the vascular volume, vascular space relationship, which is determined by the interrelationships of venous capacitance, conductance, and blood volume. Clinical assessment and support of the circulatory and perfusion states demand comprehension of the physics and physiologic presented in this chapter. Completion of chapter 26. We did it! We did completion of chapter 26 of clinical application of respiratory care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. I'm the moderator and narrator, Uriel Riley. Thank you so much for reading with us. Completed another chapter. Welcome, YouTube. Hi, it's Heart Love. Thank you for the likes and subs. Man, I want to give a big shout out to Miss Tata for this beautiful gift and book. We have a new author in the poetry world. So we're giving him love. Jorge Venegas. He said, I started writing poetry as a way of releasing some of the tension that comes from the everyday life. Throughout my writing, I discovered a deeper understanding of my individuality, spirituality, and my concept of humanity. This collection of poems is a mix of all types of emotions, thoughts, and beliefs that we all might face throughout our lives and that he faced. Life in Poetry Form by Jorge Venegas. So I wanted to give him a shout out on this peaceful part of YouTube. It's a beautiful human being, and we'll definitely dive into it. If you get a chance, go check it out. Much love. Thank you so much. We show love. That's what we do. Uplift the people. We uplift the people, and we can start to create a beautiful, peaceful environment that embraces love everywhere. So thank you so much for having empathy as well and compassion. We made it through another day. Gotta give thanks. We made it through another chapter. Beautiful, beautiful, beautiful. So, shaking it up on YouTube, reading books, loving on one another, doing it honorably. Glass of love water to all our friends and family, to all the light workers, all the rep techs, M techs, aspiring doctors and nurses, the healers of the world. I love you, I love you, I love you, my family and friends. I love you, I love you, I love you. Thank you so much for reading clinical application of respiratory care with us. We will go into chapter 27 when we reconvene, right? Shaking it up. Hey ya, hey ya, hey ya, hey ya, hey ya, hey ya, hey ya. Hey ya, hey ya, hey ya, hey ya, hey ya, hey ya, hey ya. Yay! The light workers, we do it. So continue to heal people, keep uplifting them, right? We master thyself. We can help others master themselves and find the right direction. Right? No fear ever. Peace, peace. What up, Marquise? Hi, it's Heart Love, Divine Risings. Happy Sunday. Happy Sunday. Yes, let's go. I want you to have a wonderful day. We just completed chapter 26. The mods are in the building. We're pushing towards 600 subs on this channel where we read books and learn from masters. I'm a master fitness trainer, certified, Uriel Riley, train athletes all around the world. So thank you so much for being here in this beautiful space with us. And I will see you soon. All right. I love you. I love you. You. I'll try and switch up the melodies for you. There's a million ways we can do it. Right? Love on one another. See you soon. Peace, peace. Have a wonderful day.